I'm Jodie Copley. I'm a Senior Lecturer and Clinical Education Program Director in Occupational Therapy at the University of Queensland, and one of my other roles here is as a clinical educator within our university clinic, so I have students on placement with me as well. Student evaluation can sometimes be seen as the trickiest part of taking students by clinical educators, because it's that judgment, it's providing feedback on their performance. It can sometimes be sort of a little hard to deliver, and you want to be sure, I guess, you want to be sure about what you know about the student and their performance and be able to sort of give that back to them in a way that's constructive and doesn't knock their confidence too much. Using the SPEF-R for student evaluation is a fabulous framework, because I find that I can frame the whole placement around the structure of the SPEF-R, and that helps the student to be aware of how they're progressing in all of those areas the whole way through the placement. So at the beginning in the orientation, what I find useful is to actually look at the objectives of what I want them to learn in this particular setting according to the areas of the SPEF-R. So I'll say, in terms of professional behaviour, in this environment, this is what this looks like and this is what I'm hoping you'll learn. In terms of interaction with service users, in this environment, our service users are like this and they have a range of communication abilities, and so what I want you to learn is to be able to adapt between those, and you'll be interacting with these kinds of professionals, so this is what interaction within the team will look like in this setting. So they can really classify, I suppose, or categorise what they're doing in that environment in terms of how it fits in with the SPEF, and have that in their mind. So then when they set learning objectives after a couple of weeks, we look at that across the SPEF areas again and say, okay, well, you've got a couple here that are about communication. I'm thinking now that maybe one on service evaluation would be useful from what I've seen you do. I think that'd be a good area to concentrate in, and you can frame it according to that. At the halfway evaluation, I guess I've just developed doing this over time. I often get the students to write just a one-page of points of what they've got out of the evaluation, so I can see what they've interpreted, because we'll often use whatever language we feel is appropriate to convey what we think about their performance, but we don't really know how they're receiving it unless they tell us. So getting them to tell us early on, and I often also ask them to divide that into what's going well, what do we need to work on further, and they have to tell me what's going well first, so that we have that as a structure to review their learning goals at halfway and change, adapt those. Yeah, I think you've nailed that one. I think we can move on from that. Let's set a new one on this because I think you're up to that now, and use that feedback in a very constructive manner and a purposeful manner to guide the rest of the placement. So that as you're getting through to the later stages, they're getting, and you've got all your feedback sessions and so forth you're doing on some kind of regular basis as you can throughout the placement, they're getting feedback on how they're progressing in those areas. And so once they get to the final evaluation, hopefully there's not a lot of surprises. You've talked about most of those things already, and if you're able to bring it back to those areas of SPEF and locate it in a particular area of performance, and there's goals around it, then you can be really explicit about what you're expecting. Sometimes if students are struggling a little bit, I'll be saying to them a couple of weeks before the end of the placement, this is what I need to see. So this is where you've got to in this area, in your clinical reasoning or in your assessment preparation or in your interaction with clients. what I need to see if the student is struggling, what I need to see as a minimum is A, B, C. Show me that. So there's no way of there being a communication breakdown between the educator and the student as to where you want them to be at in order to pass the placement, what it is you're expecting. So I think sometimes or often it's useful to be that little bit sort of concrete with them towards the end, particularly if they're finding some things a little bit more difficult, so that the end has always been in sight. The end that you're expecting with their evaluation has always been visible to the students, and you're giving them regular feedback as to how they're getting towards that and what they need to do next to get there. So it's lots of thinking on our part as educators, but it does make your life easier because it's very clear and it's very explicit.